If you work with children in any capacity, you won't want to miss today's episode. Each year, nearly 4 million children undergo procedures involving anesthesia. In today's episode, we will meet with an expert to explore new research on pre-anesthesia anxiety in children and what it means for your practice. Welcome to the Journal of Pediatric Surgical Nursing podcast. I'm your host, Dr. Terry Clark. And I'm so honored to welcome our guest today, Dr. Ann Johnson. She's an associate professor of nursing at Texas Christian University and a nurse scientist at Children's Health. Welcome, Dr. Johnson. Thank you so much for joining us.
Well, thank you for inviting me. Very excited to be here.
Yes, we're honored to have you. So you recently co-authored an article in the Journal of Pediatric Surgical Nursing titled Peri-anesthesia Exploration of Anxiety and Child Behavior in English and Spanish-Speaking Families. What inspired you to pursue this research?
Well, first, it was one of my colleagues in the Pre-Anesthesia Assessment Department. I work with a team of nurse practitioners and physician's assistants, but one nurse practitioner in particular had heard about some research being done in the area, and she really thought that our team and our department could do something similar, but on a larger scale. And so she really was the main one that inspired me. Her name is Dr. Bonita Conley, and she encouraged me to kind of start building our research team within our department. And that led to a pilot study and another pilot study, and then finally our larger study. And the other thing that inspired me was that in some of the studies that have been done, it was only with English-speaking families, and a big portion of our patient population is Spanish-speaking, being in Texas. And so I really wanted to include Spanish-speaking families as well.
Yeah, no, that's awesome. I lived in Texas for a little while, so I definitely can see that. And I thought it was so interesting because like one of my bigger memories as a kid is when I had my tonsils and adenoids out, and so it's still stuck in my brain as being a kind of a, not that they did anything wrong, but it was, definitely kind of an experience that I didn't forget. I remember them having me count backwards from 100 when they were putting me to sleep and stuff, and I can still see the lights and everything. So it can definitely be.
That's a wonderful example. And actually, I can remember mine too.
Yes.
Of just how impactful those types of experiences are to children.
Right. And then I know like they would will you away from your parents. I remember once I had children of my own, they, some started to kind of let them go to sleep first before they took the parents away. I was like, that's better because I remember them, dragging me away.
Yes, things have definitely come a long way.
Right. Okay. So can you briefly walk our listeners through the main purpose of this study?
Yes. Well, we wanted to examine both the child and the parent pre-anesthesia anxiety. And we wanted to examine this at different time points in the peri-anesthesia period. And we also wanted to look at other factors that might be related to the child anxiety, such as how prepared the parents felt about the upcoming anesthesia. And in addition, look at things like duration of anesthesia that might impact how the child progresses through the experience, and also how the child's behavior changed after the anesthesia. Those were all some things that we were really interested in looking at to see if there were any correlations. And so to do that, we did have 4 different time points in our study where we first assessed the anxiety on the child and parent anxiety on the day of the pre-anesthesia clinic visit. And then again, the child anxiety on the day of the procedure. And then we wanted to check in with families afterwards. So we checked in with them by telephone at 2 and 4 weeks after the anesthesia to see how their child's behavior might have changed after anesthesia. And in addition to that, we wanted to look for some other potential correlates, such as the pre-medication that they got and the duration of anesthesia. So to do that, we had to do a brief medical record review during our data collection.
Right. It's so interesting. And I really like this idea. So what were some of the key findings of the study?
Well, we found out overall children can report their own anxiety. And I forgot to mention this was a group of children aged 7 to 12 and their parents. And on average, the children did report mild anxiety on the day of the pre-anesthesia clinic visit, and then on average, moderate anxiety on the day of the actual procedure. We found that child anxiety was not correlated statistically with their parent anxiety, but the parents did report some anxiety. We used the state trait anxiety scale. We used just the state portion of that scale. And the scores on that scale for the parents were mild to moderate anxiety with, interestingly, the Spanish-speaking parents reporting significantly higher anxiety compared to the English-speaking parents. On their survey, they also were answering a question about how prepared they felt for their child's anxiety, and the Spanish-speaking parents reported significantly less feelings of preparation. So other interesting findings were that there was only minimal to mild post-anesthesia behavior changes in the children, and this was assessed using a validated post-hospital behavior questionnaire. And any changes that they did have in their behavior were not related to anesthesia duration or related to the type of pre-medication that they were given. Like sometimes they're given an anxiolytic type sedative medication prior to the general anesthesia, but the behavior changes were not related to either one of those.
Yeah, this just is so interesting and seems so valuable. It kind of makes me giggle a little. I was a child of a teenage mom, and at one point, I hate to even admit this, but we had glass thermometers, and I actually sneezed and bit the thermometer in half when I was 4. And you're talking about the child's anxiety and the parents not always being in alignment, and I swallowed the glass and the mercury and everything, and my mom, in early 20s probably at this point, was just frantic, calling the hospitals. I grabbed her arm and said, "Mom, I'm all right." So it made me think of that. Whenever you're saying it doesn't always mean that they may not be coping the same.
No, they're not always on the same page.
Right. So, and then of course later I learned how terrible mercury is to swallow. So, I don't know what it did to me, but
you survived.
I survived. Okay. So what surprised you the most about the findings?
Well, definitely the difference between the English and Spanish speaking parent anxiety, as well as the Spanish speaking parents reporting less preparation. This was really a concerning finding to me, because each family in our pre-anesthesia assessment clinic really gets the same education. We use certified language services interpreters with our families that don't speak English. So that was really surprising. Also, the lack of correlation between post-anesthesia behavior changes and the duration of anesthesia, because there's some ongoing concern about the adverse effects of general anesthesia on the young child in terms of cognition and development. But we have, I guess, some preliminary evidence that would be reassuring to parents in terms of it doesn't look like their child experienced any long-term or ongoing behavior problems or changes in their behavior related to the anesthesia.
No, that's excellent. Definitely, for sure. So how do you think nurses can implement this knowledge into their practice?
Well, I really feel that child anxiety should be screened just as routinely in the clinical environment, similar to pain assessment that nurses routinely do. So I really feel like nurses can use a simple child report tool like we used, which was a tool called the 0 to 10 scale. It's like a numeric scale similar to how we assess child pain, where the child can just point to a number with some very brief, simple explanation from the nurse on how to use the tool. And that way we can truly have more child-centered care that we provide and not just guess at how anxious our patients are. And I really feel like nurses can also advocate for more content validity in some of our Spanish language teaching materials, as well as provide an environment where the parents feel comfortable asking questions when they don't understand. Because the only way we found out that these parents didn't feel prepared is because of our survey. They weren't, they were probably leaving our clinic with questions unanswered.
All right. So what are your thoughts for future research on this important topic?
Well, our study was completed just only with typically developing school-age children. And so I really feel like more research needs to be done to develop valid tools for assessing anxiety in other pediatric populations. Right now, some providers are using a tool called the NYPASS, which is an observational tool related to patient anxiety. But the way that tool is set up, I really feel that it may not capture anxiety in the very young or in the older adolescent. And again, it is an observational tool. It's not a child report tool. So I think that, definitely more research should be done with this particular 0 to 10 scale on a larger scale and with different child ages. And then also, I think we need to look at the effects of intervention for anxiety, such as the timing and the content of child life consultations with the families and the child, as well as look at other interventions that can be implemented for anxiety at the bedside.
So just as a side question, so I'm a registered nurse too. I don't know if you knew that, but I haven't really worked with pediatrics a lot. So do these scales, is it a face thing like the pain one, or do you explain the word anxiety? Do you use a different word? Does it just depend?
It does not have faces, although that could be maybe something that could be researched and developed. But it really just has the actual numeric numbers 1 through 10 on kind of a measured graduated scale. And underneath the scale, there are a few words that says with the instructions that you would give to the child, saying point to 0 if you're not worried at all. And the scale kind of uses some words in that could mean anxiety, but on a child's level. Right. So like worried. Yeah, the 10 could explain to them that would be the most worried I've ever been.
Okay.
It does require the nurse to explain a little bit on a developmentally appropriate level.
Right. No, that sounds great. I'll have to look at the tool. I just hadn't seen it. So,
it's pretty simple.
Yeah. Thank you so much for joining us and sharing this expertise with us. I think it's just so valuable and so many different layers, some valuable information just for parents, for children, for nurses. And to our listeners, thank you for listening. You've been listening to our guest, Dr. Ann Johnson. Thank you for tuning in to episode 6 of the Journal of Pediatric Surgical Nursing podcast. Be sure to subscribe to our YouTube channel, share this episode with friends and colleagues, and share on social media. You can find links to today's article and the journal in the show notes below. Thank you so much for joining us, Dr. Johnson.
Thank you so much.
We appreciate your support as we continue to promote excellence in nursing. Until next time, I'm Dr. Terry Clark, wishing you peace and health.